All my dear doctors, welcome back here. Now we are going to start with one of the very big topic, that is head and neck topic. And it is extremely important when it comes to PGME exams, head and neck as well as the neuroanatomy and embryology. These are the main topics from where most of the questions will be asked in the PGME exams, guys. So now starting with the head and neck topic, my planning here, I'll first of all teach you about three important things here. Number one, we are going to study about the cranial foramens. And number two, we are going to study about the temporomandibular joint along with the muscles of mastication, and then about the tongue topic. Now, once you are done with these three topics, you will be actually ready, and along with the dural venous sinus also. I will be even teaching you dural venous sinus. So basically, I'm going to teach you about the cranial foramen, and then the tongue topic, the muscles of mastication, as well as dural venous sinus and cavernous sinus. Now, once you are done with these topics, then you will be actually ready to learn the cranial nerves. So please follow my planning here, whatever I'm telling you in the beginning of head and neck itself, guys. Don't try to jump and directly learn the cranial nerves. I'm telling you that will be a big blunder. You'll not be able to learn the cranial nerves directly. So first learn these four topics. So repeat again, the cranial foramen along with the muscles of mastication and temporomandibular joint, then the tongue topic as well as the dural venous sinuses and cavernous sinus. So if you learn these four topics, then after that, if you learn cranial nerves, I'm telling you, you will understand everything in the cranial nerves very much conceptually. And you will enjoy actually learning cranial nerves, guys. Okay. And later on at the end, we'll actually learn about the neck topic. And then at the end, I'm going to tell you about the triangles of neck and all those things, guys. So this is how we are going to follow the entire thing for the head and neck topic. Now to begin with, as I told you, the very first topic we are going to learn is about the cranial fossae and the cranial foramens here, guys. Now look at this beautiful diagram on the screen there. Orientation is very much important here, guys. So first let us try to understand the orientation. I'm actually going to cut my cranium here like this, okay, in the transverse section like this. And after cutting the cranium here, I'm going to remove the cranial vault and throw it off. And then there'll be a brain here. Remove the brain and throw it off. Then look from above. So after removing this cranial vault, basically we are looking from above. So once you look from above, you'll be able to see your cranium from above. This is how the picture looks like. This is how the diagram looks like. Now, my dear doctors, in this, first of all, try to understand the bones which are present over there. Now, in this diagram, in the front here, first of all, you are able to appreciate this is the frontal bone here. This will be the frontal bone here, guys. Then just behind that, you are able to appreciate the sphenoid bone, and this will be actually the body of the sphenoid bone. And then there will be lesser wing and the greater wing. So you are able to appreciate, I'm writing L here for the lesser wing here and the greater wing below here. So there will be lesser wing and the greater wing. In the middle, you'll be actually having the body of the sphenoid bone. And of course, here you'll be actually having the temporal bone. That is your temporal bone over there. And then finally here, occipital bone. Everyone knows this one. So what I'm trying to tell you is that don't get confused by looking at a diagram in your textbooks. Don't think this is like a vertical diagram over here. Yes, it's actually a horizontal one. We are looking from above. So frontal, then behind occipital. Then if you're looking from above, you'll be able to appreciate the sphenoid bone and the temporal bone over there. Now you can appreciate the depressions over here, sir. And in anatomy, we know the depression will be actually known as the fossa. So you'll be able to appreciate easily the cranial fossae here. So this one which is present in the front over here, this one will be referred to as your anterior cranial fossa. And this one here will be the middle cranial fossa, which is highlighted in the light green color over there. That is middle cranial fossa. And the anterior and the middle cranial fossa separated by this lesser wing of the sphenoid bone over here. And then behind here, you'll be actually having the posterior cranial fossa, and they are separated by your temporal bone. This is nothing but the apex of the petrous part of temporal bone, guys. That is apex of petrous part of temporal bone. So in this manner, the entire cranium will consist of three cranial fossae. There will be anterior and the middle and the posterior cranial fossae, guys. Perfect. Let's draw this diagram here. So now let's draw the diagram of the cranial fossae, guys. Cranial fossae. So imagine this will be the cranium that we are actually looking from above, and this will be the body of the sphenoid bone here. This being the lesser wing over here, and this one here will be the apex part of the temporal bone. Now we all have seen just now that the entire cranium will be actually divided into three cranial fossae. This one will be the anterior cranial fossa, and this here will be the middle cranial fossa, and finally here this one will be the posterior cranial fossa, guys. So there will be 3 cranial fossae. Now, once you have learned this simple stuff over here, now the most important thing is inside these cranial fossae, you will be able to appreciate many openings. And openings, they are known as the cranial foramens, guys. They are known as the cranial foramens. So let us see all those cranial foramens one by one. And we got to obviously learn what are the structures going to pass through those cranial foramens here. What are the most important topic here, guys? Okay. So let us see the cranial foramens and what are the structures passing through all the cranial foramens here. Now in this diagram, first of all, I am able to see here, this one will be the cribriform plate here, sir. This here will be the cribriform plate. Perfect. That is the reason why I told you guys in the very beginning, remember the orientation. Orientation is very much important there. If that is a cribriform plate, basically we are looking the diagram from where? We are looking from above. If you're looking from above, that is actually above my nose or the nasal cavity there. That is the reason why what is going to pass through the cribriform plate, it is cranial nerve number 1, olfactory nerve. Olfactory nerve is the one which is going to pass through the cribriform plate. Perfect. Then behind this, you are able to appreciate that there is one more opening over here, and this opening will be actually the optic canal. That is optic canal, guys. Now, what is going to pass through the optic canal? Obviously, the cranial nerve number 2, that is your optic nerve. And not only optic nerve, my dear friends, remember, even ophthalmic artery. Even ophthalmic artery is also going to pass through the optic canal. And here itself, try to recall in your mind, ophthalmic artery is a branch of which one? We have learned that in the neuroanatomy, ophthalmic artery is a branch of your internal carotid artery. Internal carotid artery, and in fact it is the first branch of internal carotid artery, guys. Try to recall. It's a branch of internal carotid artery, that to first branch of the internal carotid artery. Perfect. And now comes the important concept here, guys. Try to first of all understand here. Above you are able to see here, this will be the lesser wing of the sphenoid bone. Let me just write on the other side. This is the lesser wing of the sphenoid bone. And below here, you are able to appreciate the greater wing of the sphenoid bone, sir. Now, between this lesser wing and the greater wing, there will be, between this lesser wing and the greater wing, there will be one opening over here, and this opening is referred to as superior orbital fissure. This opening is referred to as superior orbital fissure. Now, you will not be able to appreciate this opening very clearly in this diagram. Why? Because just imagine this one to be the lesser wing and this is the greater wing, and between the lesser wing and greater wing, there will be opening here, that is superior orbital fissure. But we are actually looking at this diagram from above. So that is the reason why we are not able to look at this one. So what you have to do, you have to just catch hold of the skull, slightly tilt that. If you just tilt that, then you will be able to appreciate the superior orbital fissure over there, guys. So therefore, just try to remember, between the lesser wing and the greater wing here, you will be able to appreciate the superior orbital fissure. Superior orbital fissure. Okay. Now, what will be the structures which are going to pass through the superior orbital fissure? And I want you all to learn this a little bit conceptually, guys. If any structure is going to enter through the superior orbital fissure, where will it go? From the superior orbital fissure, where will the structure go? Those structures will be entering into the orbit. From the superior orbital fissure, it will enter into the orbit. So again, try to understand or recall the orientation in your mind. We are actually looking at this diagram from above, and then yes, from the superior orbital fissure, the structures are entering inside the orbit here, guys. Perfect. In the orbit, we'll be having eyeball. Eyeball is actually surrounded by extraocular muscles. And every medical student throughout the world knows that extraocular muscles will be supplied by which nerve? There is a famous formula. SO4, LR6, rest all by 3. Superior oblique by 4th cranial nerve. LR6, lateral rectus by 6th cranial nerve abducens, and remaining all the extraocular muscles rest all by 3rd cranial nerve, oculomotor. So I mean to say, you require which nerves for the extraocular muscles over here? Number 3, number 4 and number 6, guys. Oculomotor, the trochlear and abducens. All these 3 are required. And from where are they going to enter into the orbit? In the orbit, they are going to enter via the superior orbital fissure. So cranial nerve number 3, and then the cranial nerve number 4 and the cranial nerve number 6, guys. Oculomotor, and then the trochlear and the cranial nerve number 6, that is abducens. Now, what is the name of the cranial nerve number 5? Hope you are telling trigeminal nerve. And trigeminal nerve is in turn divided into 3 branches, that is ophthalmic, maxillary, mandibular. And from the name itself, we can understand ophthalmic nerve of trigeminal. It has to enter into your orbit only. Okay. And just for the sake of representation, we'll represent that as 5-1, 5-2 and 5-3. Okay. So therefore, ophthalmic nerve, that is 5-1, will enter into the superorbital fissure. Or to be more specific, let me tell you, exactly 5-1 will not enter the superorbital fissure, the branches of that one. Okay. Ophthalmic nerve branches will enter into the superorbital fissure. So for example, if this is the superior orbital fissure, just for the sake of example, I'm telling you, superorbital fissure. So ophthalmic nerve is not directly entering inside and dividing. No, just before entering into the superorbital fissure, ophthalmic nerve will be dividing into the 3 branches, guys. The frontal, the nasociliary nerve and lacrimal branch. Okay. So better we'll write down in the bracket here just as not exactly 5-1, sir. The branches of 5-1 will enter inside. Branches of ophthalmic nerve will enter. And branches, don't worry, we'll learn them separately in the cranial nerve. When I'm going to teach you about trigeminal nerve, I'll teach you in detail about the branches and all those things. Perfect. Next one. Apart from all these nerves, remember even the ophthalmic veins will also enter into the superior orbital fissure. So ophthalmic veins will also pass through the superorbital fissure, guys. So these are all the structures passing through superorbital fissure. Let me just sum up. Cranial nerve number 3, 4 and then 6 and then 5-1. The branches of 5-1 and ophthalmic veins. Is it okay? Fine here. I hope now you are able to understand my planning. Why did I tell you to learn about these 4 topics before learning about the cranial nerves? There is a reason behind that. Now when I am going to teach you about all the cranial nerves one by one, for example, oculomotor nerve right now. Cranial nerve number 3, oculomotor nerve. Now from this diagram, you can easily recall in your mind, oh, it is the one which is going to pass through superior orbital fissure and it is going to supply to extraocular muscles. Understanding? So all this information we are going to just collect and apply that when we are going to learn about the cranial nerves, guys. One advantage of learning like this. And second advantage of learning like this, I'm actually showing you all the things on the image here. And nowadays, a lot of image-based questions are being asked. So be ready for that one, guys. Is it okay? So don't try to learn in that table. I have seen most of the students mugging this one. All the cranial foramen and structure passing through that, they are mugging in a tabular form. Okay, now foramen name and the structure passing. That is not the right way. Learn with the image here. You should be able to identify the foramen in the image. Perfect. After superior orbital fissure, you are actually able to see the 3 foramens one by one here. That is foramen rotundum, the foramen ovale and the foramen spinosum. Foramen rotundum, foramen ovale and the spinosum here, guys, one by one. So there will be rows. So foramen rotundum, I'm just writing as F here. And this one will be the foramen ovale here. And then the foramen spinosum. Rows. So foramen rotundum, foramen ovale and foramen spinosum. This is one of the hot favorite thing of the examiners, guys. Now what is going to pass through foramen rotundum? If you have appreciated one thing here, all the cranial nerves will be actually passing in order here, guys. All the cranial nerves are going to pass in order. So cribriform plate number 1, optic canal number 2, and then superorbital fissure 3, 4, 6 and even 5-1. So keep an eye on that one. All the cranial nerves are actually passing in order. And till now we have completed like 6 cranial nerves. But 5th one, this incomplete. Trigeminal nerve is incomplete till now. Only 5-1 we have learned. Now what about the 5-2 and 5-3? Remember, 5-2 will be passing through the foramen rotundum. Hope you already know the name, guys. 5-2 is nothing but maxillary nerve. And obviously 5-3 should be passing through the foramen ovale, that is mandibular nerve. But hold on here. It's not only the mandibular nerve passing from here, foramen ovale. There are some more structures passing from here. And students love to remember that with the mnemonic as male. Male is passing through ovale, foramen ovale. Okay. So let us just write it separately somewhere else. So foramen ovale. The structures passing through foramen ovale, the students love to remember as male. And in that male, M stands for mandibular nerve. And mandibular nerve, we are going to indicate that as 5-3, the 3rd branch of trigeminal nerve. Then A stands for accessory meningeal artery. Accessory meningeal artery. and that is actually a branch of maxillary artery, and I am going to teach you about the maxillary artery in detail later on. But there is a connection, try to remember here, accessory meningeal artery will be a branch of your maxillary artery. L stands for lesser petrosal nerve. Lesser petrosal nerve, it's actually a branch which we are going to come across in cranial nerve number 9, that is glossopharyngeal nerve, guys. So we'll come across all these things one by one. And finally, E here stands for emissary veins. Perfect. So foramen ovale, remember the mnemonic. What are the structures going to pass through that one? Male. And M stands for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and then E stands for emissary veins, guys. All these are the structures going to pass through foramen ovale. Now coming back to our diagram, guys, let's complete there. The next one will be the foramen spinosum. Now what is passing through the foramen spinosum? There will be a nerve, and that nerve will be nervus spinosus. Nervus spinosus, okay, and then there will be one more artery, that is your middle meningeal artery, guys. Middle meningeal artery, I'm just writing in short, middle meningeal artery. Now this is something extremely important here. Why? Number one, nervus spinosus is the main nerve which is going to supply to the dura mater. It is the chief nerve of the dura mater. So there is a foramen spinosum. Nervus spinosus will go and it will enter into the cranium, I mean to say the cranial fossae there, and it is the chief nerve which will be supplying to the dura mater. Same is the case with the middle meningeal artery. Foramen spinosum, middle meningeal artery is also going to enter into the cranium, and it is the chief artery which is supplied to the dura mater. Oh, that actually gives rise to a very potential question here. The chief nerve and the chief artery to the dura mater are passing through which foramen? That is foramen spinosum, guys. So the chief nerve of the dura mater, nervus spinosus, and the chief artery to the dura mater will be middle meningeal artery. Both of them, the main artery and the main nerve, are going to pass through the foramen spinosum. So that's one important thing. Second important thing is, just look at the location of the foramen spinosum, guys. Foramen spinosum is very much closely related to your temporal region over here. It is very much closer to the temporal region there. So therefore, in this region, if a person gets any hit, if there is a trauma in that region, this is a very delicate region here, temporal region. If there is a hit in that region, you can clearly see the foramen spinosum is very much nearby, and the artery passing through that one is middle meningeal artery. That artery will be actually ruptured. If that artery is ruptured, it will lead to hemorrhage, and that is your epidural hemorrhage. So rupture of middle meningeal artery, if this middle meningeal artery is ruptured, it will lead to epidural hemorrhage, sir. Epidural or extradural hemorrhage. And later on in the radiology, you know very well how to differentiate between epidural and the subdural hemorrhage and all those things, guys. But my work in anatomy is, yes, what is the artery that is involved in epidural hemorrhage? That is middle meningeal artery, and it is going to pass through which foramen? Foramen spinosum. That's my work here in anatomy done. You can correlate that with the radiology part, guys, like how to differentiate epidural and subdural hemorrhage. So that is about the three important foramens, that is foramen rotundum, foramen ovale, and foramen spinosum, sir. So basically ROS. Done. Then after that, we are able to appreciate one important foramen over here. And this foramen here, my dear friends, remember, that is in which bone only? Temporal bone. And there you have got your external ear, the middle ear, and internal ear. And that one has to be your internal acoustic meatus. So this opening is internal acoustic meatus. Now, come on, follow again the sequence of the cranial nerves. Till now, how many cranial nerves has been completed, guys? Till now, how many cranial nerves we have completed? Totally 6 cranial nerves we have completed. And now, passing through the internal acoustic meatus will be cranial nerve number 7, that is your facial nerve, and the cranial nerve number 8, that is vestibulocochlear nerve. Obviously, it is internal acoustic meatus, internal ear, and it has to be vestibulocochlear nerve passing from there only. And we'll learn about that in the auditory pathway topic, guys. So 7th nerve and the 8th nerve is passing from there, and along with the labyrinthine vessels. Labyrinthine vessels, they are going to pass from here. Why? Because these are the one which are supplying to your internal ear. So 7th, 8th, and the labyrinthine vessels are going to pass through the internal acoustic meatus. After that internal acoustic meatus, we are able to appreciate one more opening over here, and this one will be the jugular foramen, guys. This is another important foramen, very important foramen, jugular foramen. Why? Because from here we are able to see the cranial nerve number 9, glossopharyngeal, cranial nerve number 10, vagus, and the cranial nerve number 11, that's your accessory nerve, are going to pass through jugular foramen, sir. So cranial nerve number 9, 10 and 11 will be passing through the jugular foramen. Okay. Now, apart from this, remember one more important thing. Not only these 3 cranial nerves, you also will be observing here, there will be inferior petrosal sinus, and not only inferior petrosal sinus, along with that, you'll also be able to appreciate the sigmoid sinus. So, inferior petrosal sinus and sigmoid sinus, those 2 sinuses are also going to pass through the jugular foramen. And after passing, just below that foramen, they are going to combine and form the jugular vein, guys. Of course, there will be internal jugular vein formation. And now, I can clearly tell you that 100% you will not be able to understand this one here. Like completely you will not be able to understand what is that inferior petrosal sinus and where is that sigmoid sinus coming from there. Don't panic. We are going to learn about the dural venous sinus. So all the dural venous sinuses and even the cavernous sinus, when you learn that topic, this will become easier. So I know very well, I can understand you. You will not be able to understand this completely right now in the cranial foramen, very first topic only. So later on when we study about dural venous sinus, it will become crystal clear. Don't worry. So for now, you just write down there. So cranial nerve number 9, 10 and 11 along with inferior petrosal sinus along with the sigmoid sinus, all of them are going to pass through jugular foramen. Then apart from this, if you are able to appreciate this small opening by the sides, this one, there will be a small opening here, there will be a small foramen here, and that foramen will be actually referred to as hypoglossal canal. And hypoglossal canal, from the name itself you can tell, the hypoglossal nerve is going to pass there, the cranial nerve number 12 is passing through the hypoglossal canal. The last and final one, which every student loves, it's very easier one, guys, that is your foramen magnum. So finally here we have got the foramen magnum here. So, out of all the foramina, out of all the cranial foramina, the largest one, the foramen magnum. Now what is going to pass through the foramen magnum? Remember, it will be medulla oblongata. Medulla is going to pass through that one. I have seen certain students, some students during their first year MBBS, especially when we take the foundation classes and all, during their first year MBBS, my dear friends, students are like, spinal cord is going to pass through foramen magnum. Absolutely wrong. It's a big blunder. Why? Because it's given clearly in the Gray's Anatomy, the latest edition of Gray's Anatomy, that in the foramen magnum, you still have medulla. And that medulla oblongata is going to pass through the foramen magnum, then right from the C1 vertebra, the first cervical vertebra, from there begins your spinal cord. So spinal cord begins from C1, not from the foramen magnum, guys. Along with the medulla oblongata, you also have vertebral artery. Vertebral artery will enter into the cranium via this foramen magnum only. And there will be like 2 branches of vertebral artery given from here only, that is anterior and posterior spinal artery. Anterior and the posterior spinal arteries are also going to pass through the foramen magnum. And then you will be able to find the apical ligament of Dens, apical ligament of Dens, and even the tectorial membrane, guys. There will be one more membrane there, that is tectorial membrane. That is actually the continuation of ligaments only. So tectorial membrane, the apical ligament of Dens, anterior and the posterior spinal arteries, along with the vertebral artery as well as medulla oblongata. All of these are the structures which are passing through the foramen magnum, the biggest or the largest foramen out of all the cranial foramens, guys. Okay. So by this, we complete actually all the cranial foramens and the structures passing through the cranial foramens in a simple and easier manner. And the good thing about learning like this here, my dear friends, the good thing about learning like this here, you are able to even identify each and every foramen if it is given as an image-based question. Now, once you have done with all these foramina here, I'll tell you about one more foramen, guys. Look at this diagram carefully. In this, if you are able to appreciate, there is one foramen over here. And that foramen, the margins of that foramen are not like uniform, they are lacerated. That is why it is said to be the foramen lacerum. It is said to be foramen lacerum. So let us write it separately about that. Now, what is going to pass through foramen lacerum here? There will be internal carotid artery, guys. Foramen lacerum. There will be internal carotid artery passing through this one here. But you have to be like literally very, very careful here. Why? Because internal carotid artery is not passing throughout the foramen lacerum. Internal carotid artery is not passing throughout the foramen lacerum. Okay. It is just passing in the upper part of that one, or superior part. So, internal carotid artery is present only in superior part of foramen lacerum. Why? Because the lower part is actually closed by cartilage there, guys. So you have to be like very careful. Why? Because a tricky questions will be asked in the exam. Is the internal carotid artery present in the foramen lacerum? Yes, it is present only in the upper part. But is it passing throughout the foramen lacerum? No, it is not passing throughout the foramen lacerum. Why? Because lower part of the foramen lacerum will be actually closed by a cartilage, guys. So let me give you some more clarity here. Just imagine this one to be a bone here. Like, I'm not going into the detailed part of this bony structures and also. The internal carotid artery will actually enter from here, that is your carotid canal, and then it is going to take a turn and then pass through the foramen lacerum. So that's your internal carotid artery, and this is the foramen lacerum that we are actually able to see from above. That is foramen lacerum we are seeing from above. And you can clearly appreciate only in the upper part you will be actually having the internal carotid artery. Why? Because the lower part of this one will be closed with the help of a cartilage here. So you just imagine that one to be a cartilage, and that cartilage is closing. So that is the point which I am trying to put in your mind. Internal carotid artery is present only in the upper part of the foramen lacerum, whereas the lower part is actually closed by the cartilage. By the way, sir, below it is entering from where? Remember, it is the internal carotid artery is actually entering from a canal here, and this canal is said to be the carotid canal. Carotid canal, guys. So it's entering from the carotid canal, taking a bend, and then moving through the foramen lacerum over there. So what is this artery here? This one is nothing but your internal carotid artery. And without any doubt, we all know, we have been learning from first year MBBS days, surrounding this, internal carotid artery, will be having the plexus of nerves, the sympathetic plexus of nerves. Around that internal carotid artery, you'll be able to find the sympathetic plexus of nerves, and from there only begins the deep petrosal nerve. It's not greater petrosal, it's not lesser petrosal, it is deep petrosal nerve, and we will be speaking about that in detail in the cranial nerves. Even if I tell you right now about that deep petrosal, greater petrosal and all, and VDN nerve and everything, you will actually get confused. So better we'll do one thing, we'll discuss that in the cranial nerve part. Okay, so for now, concentrate on the internal carotid artery. It's not passing throughout the foramen lacerum, it's present only in the upper part of the foramen lacerum. Why? Because lower part is actually closed by the cartilage over there. Done. So this completes all your cranial foramens and the structures passing through them in a crystal clear and the conceptual manner, guys. That's all.